Hi, my name is Matt Vanderhook, and I'm the Imaging Physics Residency Program Director here at Henry Ford Health System. We want to thank you for your interest in applying to our residency program, and we know that you have an important choice ahead of you. It is our hope that by participating in the virtual interviews with our staff over the coming weeks, that you'll get all the information that you need to prepare for this next step in your career. To that end, I've prepared a short informational video with answers to some of the questions that we most commonly receive from our residency applicants. It is our hope that providing you with this information up front will give us more time during the virtual interviews to learn more about you and for you to ask more detailed questions about our residency program, Henry Ford Health System, and Southeastern Michigan. I will now turn the floor over to Ashley Rubenstein, our residency program co-director, and the informational video will follow after that. We're really looking forward to meeting you.
Hi, I'm Ashley Rubenstein. I'm co-director of the Imaging Physics Residency Program here at Henry Ford. Just want to say how excited we are to have you interviewing with us. And we hope that you enjoy this short video about our program. I look forward to meeting you during the interview.
The residency program at Henry Ford Health System is a 2-year residency program, and we allow you to focus in one of 2 areas, either diagnostic imaging or nuclear medicine. We have 2 residents in total, 1 per year, and we have 11 staff physicists. In addition to those staff physicists, we have 2 medical physics assistants who assist with X-ray and fluoroscopy compliance testing, and they also assist the radiation safety officer. We also have 1 administrative assistant who serves as both the residency coordinator and the secretary to the radiation safety office. Here we'll discuss the rotation structure and the timing of the residency. Each rotation spans 2 or 3 months, depending on rotation content, national conferences such as AAPM and RSNA, and holiday breaks. Regardless of whether you choose the diagnostic imaging physics or nuclear medicine physics option, the first part of the residency program is basically the same. In the first 9 months, you will have 4 rotations covering general radiography, computed tomography, radiation safety, and nuclear medicine. In March of your first year, as you approach the end of your nuclear medicine rotation, we will ask you to formally decide if you'll be proceeding with a diagnostic imaging physics or nuclear medicine physics residency. If you choose the diagnostic imaging route, then you will continue with rotations in fluoroscopy, informatics, and mammography, followed by a 3-month MR rotation and a 1-month ultrasound rotation. Then finally, the last 6 months of your residency comprise an independent rotation where you'll be able to choose specific topics and areas into which you would like to delve more deeply. Typically, residents accept job offers during this time period, so they often use the independent rotation to help them prepare for their upcoming job. For example, a former resident accepted a job at a pediatric hospital, so they spent the 6-month independent rotation focusing on the pediatric specific aspects of all imaging modalities. Alternatively, residents may choose to pursue a nuclear medicine physics residency. For this nuclear medicine option, the nuclear medicine rotation is extended from 3 months into a full 12 months spent pursuing advanced nuclear medicine physics, where you become very much a part of the nuclear medicine physics group, which includes several of our staff members. This extended nuclear medicine rotation is followed by a 1-month informatics rotation and then a 2-month MR rotation. Finally, the last 3 months of your nuclear medicine physics residency comprise an independent rotation where, again, you'll be able to choose specific topics and areas that you would like to delve into more deeply. While you are on a rotation, that rotation will guide the majority of your activities. you will have additional independent testing requirements that are added responsibilities after completing a rotation. For instance, after completing the X-ray and fluoroscopy rotations, it's expected that you will complete independent testing of a certain number of fluoroscopy and X-ray systems before the completion of your residency. The same thing is true for a limited number of CT, MR, and nuclear medicine systems, although the number is significantly less. We also expect all of our residents to complete the initial qualifications and experience necessary for MQSA so that they are prepared to test mammography systems should it be required as part of their future job. Even while you're on a specific rotation, you may continue to work in other areas, especially in the instance of any unique events, such as the installation of a specific piece of equipment that's highly unlikely to occur again during the rest of your residency. You will also have time to prepare presentations and to work on projects that stem from previous rotations or personal interests that you may have in working with other rotation mentors. You can also participate in education of our medical staff, residents, and technologists. We also have a residency-long rotation on some of the more professional aspects of medical physics, where you will take a deep dive into professionalism, ethics, healthcare economics, and health policy. The salary for our residents is paid every 2 weeks. For the 2024-2025 medical year, the annual salary for our first-year resident is just under $69,000, and the annual salary for our second-year resident is just over $71,000. Our residents also receive full health insurance with dental and vision plans. If you have specific questions about coverage and options, there's a link to resident benefits on the Henry Ford Health Imaging Physics Residency website, where you can get all the information for this year and its current benefits. In addition to salary, our residents also receive $1,500 per year meal stipend that can be spent at any Henry Ford Health cafeteria. Furthermore, you will receive an additional $1,000 each year for professional development. You can use this fund to pay for books, membership dues, educational courses, a one-time iPad purchase, and any non-participant travel, which means travel where you're not presenting something. You'll also receive an additional $1,650 per conference if you're presenting something, which means either a poster or an oral presentation, which then you will hopefully write up as a journal article or other publication. Note that there's no limit on the $1,650 per conference if you're presenting during your residency, and we strongly encourage all of our residents to present at national conferences and participate as much as they can in various professional societies. As a resident, you will receive 22 paid vacation days per year, issued each July 1st through June 30th. That's the medical academic year, and these days expire at the end of each medical academic year. In your second year, you will receive 5 interview days, which can be used to schedule interviews either virtual or in person as you are seeking employment for after you graduate from the residency program. You also receive 5 non-participant travel days, where non-participant means traveling to a conference without the intention of presenting a poster or an oral presentation. If you are presenting, then there's no limit on the amount of travel days that you can use. For residents that happen to give birth during the residency, you're eligible for 6 to 8 weeks of paid maternity leave. In addition, residents are eligible for 6 weeks of paid parental caregiver leave of absence. This can be used in addition to or on top of the 6 to 8 weeks of paid maternity leave. We do adjust the rotation schedule if that were to occur. In addition, you're issued a Henry Ford Health iPhone for the duration of your residency, which allows us to have a reliable way to contact you and for you to have good phone service in all of the buildings because there are repeaters set up for that cell phone provider. There is free on-campus parking for the residents at all Henry Ford sites, and you also get access to assorted corporate discounts as part of the Henry Ford Health System, which includes things like buying or leasing new vehicles, gym memberships to local gyms, lots of local events, additional cell phone service for personal cell phones, and other things like that. Here are the headshots for all of our current residency staff. We've listed here also their respective areas of coverage to help you prepare for your virtual interviews with them. We would also like to highlight that 3 of us were at one point residents within the Henry Ford Health System, so we can give perspectives both from the imaging physics resident point of view as well as the imaging physics staff point of view. Henry Ford Health System is made up of 5 main hospitals and many smaller medical centers and clinics where we provide imaging services. There are 4 community hospitals that are located around southeastern Michigan and central Michigan, and then the main Henry Ford Hospital, which is located in Midtown Detroit. We perform over 1.8 million imaging studies across all of these sites on an annual basis. All of the Henry Ford staff and the Henry Ford Imaging Physics residents are based at Henry Ford Hospital in Detroit. Travel to other sites is expected. Although we don't require travel to the hospital and sites in central Michigan, we do offer the ability to go to these sites, but we don't explicitly request that residents attend events there. The amount of travel is heavily dependent on the rotation. For instance, the X-ray and mammography rotations include sites that have X-ray and mammography systems, which tend to be more widespread with urban, suburban, and rural locations. So these rotations have significantly more travel than, say, the MR rotation, where all of our MR scanners are concentrated at a smaller number of sites. Lastly, our residents do need to have a driver's license in order to be eligible for the residency. And so if you don't have a driver's license or have issues getting a driver's license, please be sure to mention that to me as part of the virtual interviews. We are very proud of our past residents' success. All of our former residents have found employment before their graduation from the residency program, typically 4 to 6 months before they graduate. Listed here are the institutions where our residents have found employment. In addition, our residents have a history of success on the ABR certification exam. All of our residents who have attempted parts 2 and 3 of the ABR exam have passed. If you have any questions, please feel free to reach out to either our program director, our program co-director, or either of our 2 imaging physics residents. Their respective contact information is listed here on this slide. Thank you for listening to this presentation. I hope that you found the information useful, and we look forward to meeting with you in the coming weeks.